Hello everyone. Today we discuss about four criteria of ICSR, valid criteria. First of all, first criteria is identifiable patient. Second, identifiable reporter. Third, suspect drug. Fourth, adverse event or fatal outcome. Criteria for assessing patient and reporter identifiability. Patient and reporter identifiability is important to avoid case duplication, detect fraud, and facilitate follow-up appropriate cases. The term identifiable in this context refers to the verification of the existence of a patient and a reporter. Local data privacy laws regarding patient and reporter identifiability might apply. One or more of the following should automatically qualify a patient as identifiable: age or age category, example adolescent, adult, elderly, gender, initials, date of birth, name, or patient identification number. The reporter should have first-hand knowledge and event experience. Following one or more criteria qualify to consider reporter as identifiable: initials, name of person or relationship to the patient, example parent, name of an institution, complete mailing address, professional qualification, example MD doctor, reporter, occupation, address, phone number, fax number, email address, and reporter type. In addition, in the event of second hand reports, every reasonable effort should be made to verify the existence of an identifiable patient and reporter. All parties supplying case information or approach to case information should be identifiable, not only the initial reporter, the initial contact for the case, but also other supplying information. Case to be considered as valid for below criteria: a report referring to a definite number of patients should not be regarded as a case until the minimum four criteria for case reporting are met. For example, two patients are experienced or a few patients are experienced. Should we follow up for patient identifiable information before regulatory reporting? Medical injuries about AES with no patient. Non-human subject means pet. A reporter who refuses to give his or her name or address, professional qualifications, and or relationship to the patient. In a suspect product is one which is thought to have caused the adverse drug reaction and side effect to the patient. In the case received by any marketing holder, then it is company responsibility to check if the product which caused adverse event belong to their company. Do not below criteria are used: product registered status, marketing status, in licensed or co-promoted by company or MAH globally or locally, marketing authorization holder. Okay. If only generic formulation is mentioned in report without manufacturer name, then marketing status of generic formulation will be checked. For clinical trial cases, if patient enroll in trial and receiving study medication, blinded product, or placebo, then it is considered as valid report. Criteria for not a valid suspect drug: a generic formulation of company product, manufacturer known, no event reported to company drug. In this situation, report will be sent to marketing holder of suspect product. Reportable adverse event is a foreign event to be considered reportable to regulatory authority. It should meet all the following criteria. First, an event must have occurred after receiving product. Typical events are a specific symptoms or diagnosis, laboratory finding, or drug or food interaction, lack of efficacy or lack of expected therapeutic effect as defined in the product label, medication errors, pregnancy, overdose, abuse, accidental administration, disease aggravation, and inaccuracy in the labeling instruction for use and or in promotional materials. Inaccuracies include omissions and deficiencies. The discovery of a serious public health threat, medication use error, and identify medical devices associated with the event. The event led to one of the following outcomes: the death of patient, user, or other person, serious injury to a patient, user, or other person, serious injury being a life threatening illness or injury, permanent impairment of a body function, or permanent damage to a body structure, a condition necessitating medical or surgical intervention or prevent permanent impairment of body function or permanent damage to a body structure. No death or serious injury occurred, but the event might lead to death or serious injury of a patient, user, or other person if the event recurs. Non-reportable events is the following events are not considered to be reportable events. Events same as product indication without change in severity, progression, irreparable damage, and not specified further. Patient hospitalized with no symptoms and diagnosis that led to hospitalization. Follow up to perform to get more information on cause. Rehabilitation therapy, planned surgeries, treatment, non-compliance, reported events same as medical history without change in severity or progression. Queries on product if adverse event is prior to suspect product date. Deficiency of new device found by the user prior to its use. The deficiency being one that would always be defected by the user and where no serious injury has occurred are not reportable events. If case meets above four criteria, then that report is considered as valid report. Thank you.